my name is Chelsea. I'm going to be your nurse today. I came in so I can change the dressing on your central line. Is that okay with you?
Yes.
Do you need to use the restroom or anything before?
No.
Okay, let me just put some gloves on here and I'll get you set up. Have you ever had a central line dressing change done before?
Yes.
Okay, so you don't need me to explain the procedure to you?
No.
Okay. Can you please just let me know your name and date of birth?
Mary Smith.
Okay.
July 17th, 1986.
All right. And then, Mary, do you have any allergies that you know of?
No.
No. Okay. All right. So what we're going to do is we're going to take off the dressing, clean it up, and put a new one on. I do have to put the bouffant cap on you and a mask. Is that okay?
Yes.
Okay. So let me grab my things. I did check your record here in the EHR, and it does say that it is time to do a dressing change, and it states that you are receiving IV antibiotics, so we do need to keep that central line in. So what I'm going to do is grab my supplies here, and then I'm going to clean off my table, let that air dry, and then I'm going to have my kit here, my bouffant, mask. Oops, sorry about that, Mary. Sterile gloves. I need a bio patch, a flush, my microclave, some alcohol swabs, alcohol cap. I'm going to place the stop sign on the door since there's a sterile procedure going on. I don't want anybody to enter. So for the checkoff, I'm just going to put it right here. And then I am going to get started here. So I'm just going to put your bed up here for me so I don't bend over so much. And I actually like to put my table on this side. All right, Mary, I'm just going to put this mask on you. Are you breathing okay right now?
Yes.
Okay. And then if you don't mind, I'm going to have you turn your head away from the site as well, just in case you cough or sneeze.
Okay.
Turn your head that way. And then I'm also gonna put mine on. Okay. So first I'm just going to take off that dressing. I know it's really sticky, so just let me know if it's uncomfortable for you, okay?
Okay.
And I want to arrange my supplies here. I don't need this for later. Okay. So first I'm just going to start peeling away at the distal end. That way I don't pull out the line. I see that it's not sutured in, so I want to be careful. And this one is sticky. I like to work kind of around the edges, all four sides. Once this dressing is off, I want to make sure not to touch underneath of it near the insertion site. And I want to keep it sterile. Is it feeling okay, Mary?
Yes.
Sorry, I know it's sticky. Did you get your lunch tray yet today?
No.
No. Did you order it?
Yes.
Okay. Well, it should be coming soon. My goodness, this was a sticky one. Just going to pull that off here. Okay. So I'm assessing the site. I don't see any redness or swelling, any discharge coming from it. It looks intact. And all the catheters look intact as well. So I'm going to start opening up my sterile field. I'm going to take my package here. going to peel it away from me. Okay. And before I put my sterile gloves on, I want to put my bio patch in the sterile field. So I'm going to peel it open, carefully drop it in without touching it. Okay. And now I'm going to put my sterile gloves on. I want to be careful not to turn my back to my sterile field now so it's open. Not to cross over the field. Actually going to pull up my sleeves here. Okay, I'm going to take the glove from my dominant hand first, grab it by the edge, and carefully put on my dominant hand. I'm going to pinch because this is the inside of the glove, so I can pull it down over my wrist better. And then I want to scoop on the other glove. I can hold the paper if I need. Put the glove in there. Okay, now I have sterile gloves on. I want to get rid of that paper. Okay, so now I can touch everything that's in the sterile field. I have my bio patch here. I don't need this mask because I already put one on. I don't need these gloves because I have my own sterile gloves. And I'm not going to use this drape either, but you could if you needed to. Grab all my supplies here carefully. I don't see a measuring tape in this kit, but if I needed to, I could measure the length of the catheter as well, especially if it's not sutured in. So first what I want to do, I'm going to take my gauze and I'm going to hold up the catheters so I can clean under it. So first I want to take my ChloroPrep, crack it, and without touching the patient, I'm going to lift those lines up and clean it in a scrubbing back and forth motion for about 15 to 30 seconds, just back and forth. It's the friction that helps to kill the germs, so the more friction the better. Just be careful of your patient's comfort level. So 15 to 30 seconds of that, and then I'm going to throw away my ChloroPrep, and then I'm going to take my alcohol swab stick next, and I'm going to clean in a circular motion. So I'm going to start at the insertion site and go around and work my way outwards. Okay, now I'm going to let that air dry. Once that is dry, I can then place my new dressing on it, but first I need my bio patch. And we want to be careful not to touch the patient while we're applying the bio patch. So what I like to do is fold the bio patch like a taco in half, and then I can actually take my forceps here too and help to hold up the line. Oops. And then I place my bio patch underneath of it without touching the patient. Okay, and then I can take my dressing and be careful not to touch the underside of the dressing because that is sterile. And I want to be covering the insertion site, making sure that it's clearly seen in that window. I'm just going to press down. As soon as this is on, you no longer need to worry about sterility because the insertion site is now covered. I also would then take my label, date and time, and initial when the dressing was changed. And I would place that label on the dressing but not covering the insertion site. Label that there. Then I'm going to change my cap, and for the sake of the competency, we're just going to change one cap. So I'm going to use the white one. I'm actually going to change my sterile gloves, so I'm going to take my sterile gloves off. Perform hand hygiene and put clean gloves on. Are you feeling okay, Mary?
Yes.
All right. Do you want me to take that mask off now that it's covered? You can take your mask off.
Okay.
I'll take that off for you so you can get some fresh air. There you go. Okay, so I'm going to take my microplate cap here, and I want to make sure that I open the end that's going to twist onto my flush. I'm going to scan my patient and my flush because it is technically medication. So I scan them. And I'm going to take my microclave and open it here. Being careful not to touch the tip of the microclave because we do want to keep that sterile. I'm going to open my flush, purge the air, connect it to my cap, and flush that cap. That way we're not injecting any air into our patient. Okay. Next, I'm going to take an alcohol swab, bring it over to my patient. I'm going to clamp off the line that I am taking the cap off because if I don't, otherwise blood will come out of there. So I want to make sure it's clamped. I'm going to twist off the old cap. I'm going to take an alcohol swab, and I'm going to scrub the hub of that cap for 15 seconds. Once I've done that for 15 seconds, I want to let it air dry for a second, and then I can connect a new cap. Then I'm going to check the patency of it, so I'm going to unclamp it. I will draw back for blood return, and then with a push pause technique of my flush, I will flush it all the way through, all 10 mLs. Once that is flushed, I can then clamp it again. And then I'm going to get my alcohol cap here. Take off my flush and put my alcohol cap on. Okay. You doing okay, Mary?
Yes.
All right. So now that the dressing is complete, the cap change is finished, I'm going to clean up my supplies. And then I want to make sure that I document everything. I want to make sure that I document the type of central line it is, the dressing change itself, the caps that I changed, which colors, the blood return on it, the length of the catheter if I measured it, how the patient tolerated it, if there were any issues, the need for the central line that we can continue to need it in the patient. And then we want to make sure we clean everything up. Put our patient back in a comfortable position. Bed wheels are locked, the side rails are up, the call light is within reach. If you need me, just let me know. And get your personal items back to you here on your table. Oh, look, here's your lunch tray coming in right now.
Thank you.
You're welcome. And then I think we are all set. Is there anything else I can get for you, Mary?
Nope.
All right. So I'm just going to clean up here, and I will be back soon, okay?
Okay.
All right, thank you.